Western Oregon University, and this is the Richard Woodcock Education Center, which is one of our newest buildings on campus and really a showcase for all the great things that we do here in the College of Education. In the crowd, we have the distinguished pleasure of having visitors who just arrived in country hours ago from Saitama University, just outside of Tokyo University, and we welcome them to the university as well. Thank you. I am pleased. My name is Dave McDonald, and I'm the Associate Vice President for Public Affairs and Strategic Initiatives here at Western Oregon University. And my job today is to really make sure that we have a great conversation with two leading experts in the field, experts who will share with us work that they're doing to help Oregon, especially Oregon's hard of hearing and deaf communities. This is our second of our Fireside Chats. The Fireside Chats are produced by Q-Loop, which is a student-run organization here in the College of Education. And this is a great opportunity for our students to engage in meaningful professional development activities while also supporting the college and the university's mission in working with the university community and the broader state. So all the success of this event really goes to the students, and I thank them in advance for their hard work in setting up this great facility. I have two phenomenal panelists with me today. The first is Dr. Denise Hackett. I apologize. She is an assistant professor here at Western Oregon University in the Rehabilitation and Mental Health Counseling program. She is also the principal investigator of the Community Needs Assessment for Deaf and Hard of Hearing Oregonians. And we're going to spend time talking about that grant and what it does for the state. Joining Dr. Thew Hackett will be Chad Ludwig. Chad is with the Oregon Deaf and Hard of Hearing Service Analyst in the Department of Human Services. It's a statewide agency. He has previously served as a president for the Oregon Association of the Deaf. That is the organization that is behind the start of the movement for the Community-Based Needs Assessment Program. Thank you both for being here. I'd like each of them to take a moment to introduce themselves and give some background as to what they're currently doing. Starting with Denise.
All right, yes. I am an associate professor here for the Rehabilitation Mental Health Counseling Department, and prior to coming here, I was a researcher at Rochester, New York, where I had worked for the Deaf Wellness Center and National Center on Deaf Research. There we were looking at various disparities within the deaf and hard of hearing community and what the deaf and hard of hearing community experience in the system. I was a clinical researcher, and I was associated with the Rochester Institute of Technology for 10 years, and then I came here. I have now lived here for about 3 years.
Wonderful. Welcome to Oregon.
Thank you.
And Chad?
Hello, everyone. I am Chad. I moved to Oregon about 6 years ago from Rochester, New York. And while there, I was working for video relay service industry. At the same time, on the side, I was involved in the community, also with the National Center for Deaf Health and a subcommittee on Deaf Health Committee. And they worked closely with researchers to identify the needs in the community, to understand the research methodology, and how we can incorporate the deaf community to make sure that there's a sense of the importance of the impacts on the deaf community. I've lived in a number of states before moving to Oregon. I've been in Washington, New York, California, North Carolina. And I've seen quite a bit about what each state has. Coming to Oregon, it was really, I saw a lot of opportunities, and so I'm grateful we're going to have a chance to talk about that today.
Yes, very similar to Chad. I have lived in 7 different states prior to living here, and so I have been exposed to what other states have and then what isn't here in Oregon. And that helps to help me envision what other states possess, but then also to get a true sense of the disparities here. And so we were able to really dig in and start the work here.
Well, we're very fortunate that both of you are with us now. And you are both actively engaged in the community needs assessment. And I would like to know is what really motivated you to complete that assessment. Maybe spend a moment or two talking about what it is and how it's going to help Oregon. Start with Chad on this one.
Sure. Well, when I first moved to Oregon, the Oregon Association for the Deaf was really at death's doorstep. And so I jumped onto a sinking ship and really tried to get it going again, if you will. And so working actively to set up a meeting with the president, traveling to various places in the state to meet with the community. And at each meeting, I was letting people know, I'm the new president of Oregon Association for the Deaf. I want to know what you'd like the future to look like and what goals you'd like us to accomplish. And I heard the same story, that we need a single place that provides services. And I heard that in every community that I went to. Reflecting on that, in order to start with that kind of services, realized that the community has tried many times to fight for more services in the legislature. Don't quote me on the year, but I believe in 96, 2001, in 2010, I believe, there have been initiatives, there have been campaigns over 20 years, efforts really to knock down the door. And unfortunately, the legislature has been tone deaf on this issue. Really trying to work with the legislature during the year 2013, 14, I'm bad with numbers, but 2015 through in 2015, it definitely started working to gather the community, to have the legislature recognize the need for expanded services in this state. Unfortunately, we didn't have any data to make the case. We had very few pieces, far between, and we tried to pull that together, and it really wasn't enough to have a snapshot of the entirety of the challenges that we face in Oregon. It just didn't exist in any one place. There are national numbers, but often there are estimates. And what we know from other states, we really can't compare with what we have here because we just didn't have the data to make that comparison. So the legislature really let us know we wouldn't be able to pass the bill that we wanted to, but we worked on it. We negotiated. It was Senate Bill 449A. And we established a deaf and hard of hearing services that would establish it. That before it died, in last-minute negotiations, we were able to successfully get some money under DHS for 4 bills within their budget over 2 years. And that was getting our foot in the door, getting that money. We asked the Department of Human Services to do a request for proposal for a community needs assessment that would help us to get the data that we needed. The legislature did agree to that. DHS was on board. And so we were able to get $200,000 in order to start the process for the community needs assessment. And that's how it got started.
And Denise, do you have anything to add to that?
Yeah, following the request for proposal, actually, prior to me moving here to Oregon, I had been involved in 4 different NIH-funded research projects myself. One through the National Deaf and Health Wellness Research, and that was a randomized clinical trial, and it was called the Deaf Weightwise Project. And through that, I had been able to learn how to really get out to the deaf and hard of hearing population. And as soon as this RFP had been released, I had only lived here at 4 months at that time, not knowing too many people within Oregon, but recognizing the need to develop rapport and trust within the community. And in order to do that, and in order to get the necessary data, I was able to work towards the deaf and hard of population by getting other deaf and hard of hearing individuals on board. And so after the RFP was released, we were awarded this grant, and the first step in this process, in any process in trying to get information from the deaf and hard of hearing population, was to create an advisory board, design our study, establish focus groups, and that way we could get some of this really important data. But it was a crucial bill, and in collecting this data, it truly substantiates the need for services. So, yeah.
Wonderful. So the report itself is about 100 pages, give or take. How do you decide where you can start, or where to start addressing the disparities that you identified through the focus groups and their surveys? And maybe more specifically, what are some of the key areas that you believe that we collectively in this community need to focus on from that report? And I'll start with Denise.
Yeah. The compiled report actually contains a lot of information, and it is truly just the very tip of the iceberg. It was conducted in 9 months, this entire community needs assessment from start to finish across the entire state of Oregon, and then in actually providing the report. So with such a tight time frame, there is a lot of things that we haven't been able to do yet, and we can't ignore that. The report itself, as you had stated, it's over 100 pages in length, and it did help us to identify some of the most significant areas of focus. And that's something that Chad and I continue to meet about in order to identify within those areas how we can continue to get community involvement. It needs to be community-based, and they need to let us know what their priorities are, and then we are there to assist and to be involved in what agenda they establish. That's part of the community needs assessment, but then also work with the legislation, and then DHS and rewriting their policies. A few things like that, Chad, if you wanted to add.
Yes, when the report became available, really at the tail end of December 2016, it was actually disseminated widely in January. So 14 months ago, really the report is still very fresh. In that time, 1 year, there's been a lot of discussion and analyzing what this report really means. And it's not a report that's just for the Department of Human Services or the legislature. It's really for everyone, for community groups, organizations, government agencies. Anyone can use this report and take what they feel they need to help them establish goals and really take off in overcoming those disparities that exist. The Department of Human Services has recognized disparities in a number of areas and know that they can't do everything themselves. They don't have the resources. And so the Department of Human Services has committed to addressing those issues that were brought up in the report through opening 2 positions, Oregon Deaf and Hard of Hearing Services Specialist. I'm actually one of those 2 positions. And both of us are very new in that role, less than 1 year working with the state. One of us focuses on interpreting services, interpreting scheduling, and dealing with interpreting issues and policies. My role within the organization is to work with the state throughout Oregon to provide services to the public, and that means deaf, deafblind, hard of hearing who are seeking services, where there are barriers to try to identify. Sometimes staff don't even realize that interpreting services are available, that there are possible better procedures, better policies, ways that they can provide services. And the second part of my role is for deaf-blind, hard-of-hearing people who are receiving services through aging and people with disabilities. That's within the Department of Human Services, where there are barriers in their journey to help remove those barriers. So that is one of the commitments that DHS has shown. And then another commitment this year and going forward is that the director of DHS and the deputy director, that's Fairborse Parisket, and the other is Dr. Richardson, that they will be working together with the community, meeting every 3 months, starting next month. And in those quarterly meetings, we'll be reviewing the report, bringing together stakeholders from within the community to look at it from different angles and plot out a course forward. So that's a commitment that they've made. Oregon Deaf and Hard of Hearing Services also has an advisory committee, and their retreat is coming up this next month in April. We'll be gathering together, and the work from that retreat will be to come up with a plan from within DHS to respond to the needs. And people in the community themselves may be inspired to pursue other legislative efforts. And DHS, in their overall budget, they have a number of line items, but right now figuring out what they'll be working on, because the need is so huge, as the report shows, ranging from employment issues, transportation, healthcare, human services, really just across the board. So.
Yeah. It's also very important to mention that there were 9 domains that we covered within this community needs assessment, and those were actually stated within the RFP. But there are additional domains that we could still focus on as well. And with the response to the report has been a lot of shock, just because the data is so profound. And this is the first time that we've had strong documentation and substantive evidence of what the fight looks like.
So could you share one or two of those key data points?
Would you like to, Chad, or myself? One is focused on employment. The data demonstrated that there is a very large population of deaf, hard of hearing individuals who are unemployed, and that's nothing that was too surprising. However, something that was surprising, or not surprising at the same time, is those who have advanced degrees are still earning below poverty wages. And that's significant because whenever there is a hearing loss, there is such a dependence on assistive technologies such as hearing aids or alarms that have flashing strobe lights. And those things aren't cheap. Even myself, I purchased a house last year, and I had to pay $300 out of pocket for each of the fire alarms so that they were adapted for my own use, and that was out of my own pocket. And I think that that's something important. If there had been a fire, or if there is a fire, it's important that I'm notified of it. So I need to have these things in my home, but it's not cheap. Additionally, hearing aids or other assistive devices aren't typically covered 100% by insurance. So if someone is earning below the poverty level, then that causes increasing disparities. So that was one area that we noted.
Through a lot of research, not only the data collected through the survey, but also done through key informant interviews, through focus groups. There was a lot of qualitative information that was collected through the process as well. And there we were able to learn a lot of stories about what people are experiencing, things that you might find surprising, but that to us, actually, we've probably known about. When you're in a close-knit community where you're sharing experiences and you know exactly what's going on in the grapevine, but to have that put formally in a document was something we didn't have. So through this process, the ability to document these stories that we've known and to make it real. One example would be there's a family with a child that was influenced by, there was an expert who had told this family that they should not use sign language with their child, that the child should be taught with a specific communication approach, an oral approach, that parents struggled with. They really felt that they should be signing, but because of the expert advice that they received, they felt so conflicted and decided to follow the expert advice. But the point is, there was no place, no neutral party that the parents could go to and say, you know, we're thinking about these options. Are there other options? What are the pros and cons of this versus that? Helping parents to navigate that journey, the decisions that they need to make for their family, instead of just getting the one answer that they're not satisfied with. The family knew that there had to be more options. And it's not new that professionals would do that they would withhold some of those options. They have a lot of power. And so that's shown through the research as well.
Yes, another area that we had looked at was there is such a high number of individuals who have experienced abuse, whether they're deaf, hard of hearing, or became deaf later in life. More than 3/4 of them had stated that they had experienced abuse, whether it be verbal or physical or just bullying and taunting due to the fact that they weren't able to hear. And within the employment arena, some had even requested early retirement due to what they had to put up with at work. And again, that wasn't surprising to myself or to Chad, but it was probably incredibly surprising to many others who were reading through the report. And now that we have evidence and it's actually written down in a formal record. Within my field, I teach rehabilitation mental health counseling. And this demonstrated also the increased need for mental health counselors who are proficient and well-versed with working with those who are deaf and hard of hearing. And so I think that there could be a lot of benefit for our students who are training in that field.
That's a good lead into the next question. So Western Oregon University, as a public university, really values our collaboration and partnership with our community. And given this report and the strong data points and the concerning findings regarding the challenges that our deaf and hard of hearing communities face, what are some of the things that Western Oregon University can do to help identify and address some of the disparities that were in the CNA? Chad?
Western has the Regional Resource Center for the Deaf, and there's actually an open position right now if you know anyone who wants to apply to become director. Once that position is filled, Western will definitely be encouraging that person to partner with the community to develop services, programs, seeking grants. There's a lot of things that we would like to see, places where the university could partner with the community, encouraging students to improve their experience by working in the community, working and learning. Not only that, but also expanding research. For example, the National Center on Deaf Health Research in Rochester, New York, they already have quite a bit of data nationally, but to do that same research in our state and be able to compare it with their numbers and to show that it's not an isolated thing, but something that is prevalent across the country, it really builds the strength of the argument. It's something that we know, but we'd really like to see Western developing in that area and also becoming a hub of the West, a center for deaf and hard of hearing issues.
Yeah, there are so many possibilities here that Western Oregon University could pursue in light of all of this. I encourage the staff and the faculty and the students to demonstrate their willingness and eagerness to really continue involvement. I myself have been involved with the Department of Human Services, and I've been traveling throughout the state of Oregon in training those DHS workers in how they might even be able to improve their own customer service and their relations with individuals who are deaf and hard of hearing who go and seek services through DHS. And in providing these workshops, I did that for 1 year, and I feel as though that's a small contribution in helping to minimize these barriers. But our community needs assessment truly demonstrated that there are a multitude of barriers, and so we need to continue with that education. Additionally, if policies could be written, similarly, there's a recent situation with foster children, and we would like for those foster children who are deaf and hard of hearing to be placed in homes where they have communication access, and that's something that we are able to address and look at. But then also to truly pay attention to the hard of hearing population as well. Those who are hard of hearing have very different needs than those who are culturally deaf. And though they both experience barriers, they're different types of barriers. And so we can't ignore that either. It's important for us to continue our work with both communities and then also with the deaf-blind community as well. Western Oregon University does have the Deaf-Blind Interpreting Grant, and that's a program that's being developed to work with individuals who are deaf-blind, and we want to continue on that, but then also pursue other grant opportunities and truly take advantage of that and see where we can go with it.
Good. So California has legislation called the Lead K, and I have some familiarity with it, but I'm curious, and this is for Chad, if you think that Oregon should be pursuing similar legislation, and also could you describe for our audience a little bit about what Lead K strives to accomplish?
Yes, I'd be happy to. Oregon became the 4th state to have Lead K. That is language equity acquisition for the deaf. And Lead K began in California and then started being adopted by other states, and recently here it was House Bill 3412. And the bill passed unanimously in both houses, and that's gone very well. The purpose of the bill, the legislature asked the Oregon Department of Education that they establish a task force, which would be a group of 12 people with expertise in different specialties, some of which would be like residential schools for the deaf, mainstream schools, parents, community members, and bringing together different participants. I'm also a member. And in that group we discuss the measurements of children's language development from birth to age 5. a lot of children in the state, and children being under Code 20 in this state. So Code 20 children, if you will, every 6 months or every 12 months have IEP meetings, individualized education program meetings, where a number of professionals are brought together to look at their education and their health and how they function in school. But one role that has not been filled is language. And so often children arrive at school in first grade and they're not language proficient. They're not ready to function in school with language. So the school finds itself having to catch those children up, taking a lot of time to recover from those deficits. And so through our discussions, we're identifying tools and trying to empower people on the front lines who work closely with kids from birth to age 5 to make sure that they are meeting children's language development at the levels that they need it all the way through so that they can start school on track. ODE just put out its first ever report 1 or 2 years ago it's a kindergarten readiness report. And there are a lot of questions there, but it seems to show that none of the kids were kindergarten ready in the deaf population. And so presenting that to the legislature, they were able to put a small amount of money into accommodation services, interpreting for our meetings. So we have met. The final report was presented to the legislature just in December. And the Oregon Department of Education legislative coordinator, they're looking at it, and they're looking at the education budget for next year's full session, whether to increase funding to cover some of the areas identified. Some of these measurement tools cost money, and to make them standardized would certainly cost. But the point is, these are it costs time for training and resources. So that's now between ODE and the legislature. I encourage the community to monitor this issue.
Yes, I'd like to add to that as well. What's very important is to really take a look at the big picture. I see many adults who are deaf, hard of hearing, who have experienced language deprivation and then have also struggled with employment and are now utilizing support services, Social Security income, Social Security disability. And so much of this comes back to the language deprivation that they experienced as children and how that later affects their life and the implications of that. And that's why we have to really invest more time and monies into those children at a young age so that in the long run, they'll become taxpayers and they'll have the education rather than needing to depend on state or government money. And so we'd really like to shift this paradigm. This is something that I had to experience myself. I had lost my hearing at the age of 2, and I was very fortunate to end up being bilingual, but I'd like to encourage more money and more time and investment in our youth. And oftentimes, 95% of the time, individuals who are deaf or hard of hearing have parents who are hearing, who can hear. And so they don't have the tools. They don't know how to communicate. They don't know sign language. And that's one of the things that we had identified within our report as well, is just that it's so difficult to find the appropriate resources, and we trust professionals, and then in the end, that could have devastating effects. And this has been happening historically. But deaf children end up suffering the consequences of that because adults just don't know, and then it's too late for those children to catch up in their language later when they become adults. And so that's why this is so important. We need to, now that we've collected this data, we can demonstrate that we need more resources, more funding for language acquisition and for mental health and for ensuring that these children are all caught up. It's very important. And so yes, continue paying attention to this Lead K bill.
Great responses. So we have a wonderful audience with us today, and I would like to have this as an opportunity for our audience to ask questions of our two experts. First question. Don't be shy. So if you can introduce yourself, tell us and your question.
Hi, I'm Steve Scheck. I'm Provost and Vice President for Academic Affairs here at Western Oregon. I'm very delighted to be able to sit in on the Fireside chat today. But like so many Oregonians, I am really not well informed at all of the deaf and hard of hearing community in the state. How many individuals does that represent? How many school-age children are struggling with these types of difficulties? And if you could shed a little bit of demographic light on it in terms of what the picture of the state is.
Chad?
It's a great question. Thank you for asking. In terms of early identification of hearing loss, in Oregon, children are identified as 100 children are identified every year as babies with hearing loss on average. There is about 1,200 code 20 children in the system. In terms of the US Census, these aren't great numbers, but the best we can get, Oregon has close to 187,000 individuals with hearing loss in the state. And then out of that number, if you want to borrow from Gallaudet's Research Institute and some of the formulas that they've used, 10% of that 187,000 would be the signing community in Oregon.
That's a big number. Next question.
Hi, I'm Kelly. I'm a graduate student here in the RMHC program, the Rehab Counseling Program. So my question, after looking at the CNA, I was shocked to see one particular line that the Oregon School for the Deaf is not allowed to have a preschool. So what kind of services are available for that kind of early intervention, that early education?
That's a very good question. Would you like to answer that one as well, Chad?
Yes, some number of years ago, OSD, the Oregon School for the Deaf, did provide birth to age 5 services, but at one point in 1980, in the 80s, the legislature inserted language to prevent them from providing those services. So that program was removed, and now who provides those services are the regional schools throughout the state. Through the support of early intervention services and EHDI, there's been some small monies put Hands and Voice organization, where they have a Guide by Your Side program, and they're working with parents throughout the state in Oregon, parents who have children who are deaf and hard of hearing. And so that's what's currently available. I can say that people who work closely with families, they're not neutral. They are people with biases, and they would claim to be neutral, but through the community needs assessment, it shows clearly that there are some, maybe not all, but certainly some people who are not neutral in their work, working with families who have deaf and hard of hearing children.
Yeah, and to add to that, for the community needs assessment interviews, we had interviews parents who have children who are deaf and hard of hearing, and there were multiple quotes about their frustrations in seeking and receiving services, and so we were able to demonstrate that.
Very good. Next question. Go ahead and use the microphone, please. Yeah.
So speaking of parents and families, I'm just curious if we know the availability for low-income families to have access to taking ASL classes if they want to teach their children.
Chad?
At this point, no. There are no real formal programs. There are no, this is not a resource that exists for parents. Really, parents are left to use resources like faith-based organizations. They can go through the community, through friends, you know, and ask favors, you know, who can teach sign? Where can I learn this? But a centralized resource, no. And in other states, of course, they do have formal sign language classes provided for free by the state for parents who find that they have a deaf or hard of hearing child. And for us not to have that, it's something I would love to see some improvement in, you know, soon, not too many years, because parents need opportunities to take classes for free where they won't have to go to a community college or take classes. I was recently contacted by a family who wanted to learn to sign, and they live an hour outside of the nearest available sign language classes at a community college. For them to go an hour each way to take these classes when they have other kids, they have jobs, you know, it's really just not feasible for their family to partake of that. And then think about Southern or Eastern Oregon, where you could just be out of luck. And so there's some definite challenges in this community.
Yeah, it's definitely a significant challenge, and as Chad had intimated, there are other states that have language mentors who can go to the parents' homes and teach the parents how to read books in sign language to their children, and the entire family can be involved. And that way siblings also would be able to be involved. So those are wonderful programs offered in other states, and I'm hopeful that that'll be something offered here in Oregon in the future.
Other questions? Yes.
Hi, my name is Brittany. What can we do to support the deaf community here in Oregon? What specifically can we do?
Let me clarify your question. What specifically could Chad and myself do, or?
Students in the master's programs here at Western. What specifically can we do to support the community?
Okay, those students within the RMHC program.
Or other programs, yes.
General students, okay. What can students do? Chad, did you want to answer that?
Well, what students in the RMHC program and students in general can do?
Throughout Western.
I would encourage that students work with their faculty on campus to identify potential volunteer opportunities, places where they can work. Oregon Deaf and Hard of Hearing Services is trying to work with a team of people in our state in order to find ways that we can recruit volunteers to be part of the program and accomplish some work. But you know, I've never worked for the state in the past. This is a new position for me, and the paperwork for everything is something. So I'm learning my way through how to navigate the system. I am hoping that at some point down the road, there'll be an open door for people to join our team, to give their time and support, and work on some of these important projects, because it's just the two of us in my program right now for the state of Oregon. And there are some states where an agency would have 20 or 30 people to do the same work. So it's pretty meager for the volume of work that we have. We definitely need some help.
Certainly, yes.
So you'd mentioned earlier that you're working to increase the resources available to the deaf community, including interpreting services through the state. And I was wondering what that would look like on the county level and how you might be able to put that into action. I was recently hired at the Marion County Crisis Center, and when I asked them about their service provided to the deaf community there, my supervisor told me that it was really, really difficult, and that just last week someone had come in crisis, and it took 6 hours for them to bring an interpreter in. And so clearly there's a problem going on there. What is in the works to improve that currently, if anything?
Yeah, that's a very good question. Related to the Department of Health and Human Services, they have just recently confronted similar issues where there are individuals who are seeking interpreters or who are in the midst of crisis and aren't able to secure interpreters. And this is not an anomaly. Oftentimes, even when there is an interpreter that's found, that interpreter isn't qualified. So in response to that, the Department of Human Services has brought in video remote interpreting, but that's a very temporary solution for a very short-term communication. So if someone comes in and needs to make an appointment and isn't able to get an interpreter immediately, then they're able to create the video remote interpreting technology and make sure that whatever questions of immediate concern are addressed, an appointment is made, and in the meantime they're able to actually bring in a live interpreter. So that's something that DHS has done, and that could be implemented at the county level as well. However, it requires money. Anytime that there's any accommodation, there are typically dollar signs attached. And that in and of itself is a barrier, only because often we're very aware of the fact that we're not cheap, and we carry that burden on our own shoulders, and it causes a lot of guilt amongst the deaf and hard of hearing community, because we don't want to charge other people, and we don't want them to feel as though in their accommodation of us we are too costly. But there's no way to really negate the financial concerns, and so we really want to look at that as the barrier and see what we can do to succumb that.
I would definitely encourage, in the perfect world, many nonprofit organizations and businesses are often ill-prepared to respond to the need for accommodation services. Something comes up and it's, oh my gosh, goodness gracious, how are we going to do this? And so what I encourage is that every nonprofit has a line item in their budget, 10%, that they establish for accommodations. And it's not only for deaf and hard of hearing, but many other individuals with disabilities that need accommodations, to have some money there ready. And then at the end of the year, if there's money left, it's your Christmas money for that special organizational need that you can spend it on. And then the next fiscal year, you put aside 10%. And why not? That just makes sense to do that. I'm trying to remember, there is a state back east, and I'm trying to remember which it was. There's a 10% rule in place. I'm not sure why that isn't everywhere. I think that if we had that, it would significantly decrease those barriers that exist within the community.
Yeah. And that's one thing that Western Oregon University has demonstrated as being on the right track. They've just hired a full-time staff interpreter, Chris, the one interpreting right now, who is here in order to interpret for everyone, not just for deaf faculty and staff, but for those who aren't fluent in American Sign Language. There's an interpreter available to them. And that's something that Western has implemented and would be well, it would be well if other people would copy that and replicate that as well.
So this has been an incredibly thoughtful conversation. We've had two wonderful experts who have shared their experiences here in Oregon, as well as all their experiences in other states, 7 or 9 or a dozen states that they've lived in. And we've had great questions from the audience, and I'm very grateful for that. A couple things that I gathered was we have almost 200,000 Oregonians who are either deaf or hard of hearing. We have resources that are not extensive enough to cover even a portion of their needs, from infancy all the way through to retirement. Our deaf and hard of hearing community is a community that is underemployed and underpaid relative to the hearing counterparts they have. We have a program here at Western where we have incredible students and faculty who are trying to figure out where we can play a positive role in addressing some of the needs that the CNA has identified. The CNA is just a first step, though. There's a lot more work with this 12-member community or committee that has been developed by the state. And I'm quite confident that we're going to have more conversations and more work as we begin to really work on this issue that is long overdue as a state need. So thank you to Chad and thank you to Denise for sharing their time with us. I want to thank our visitors from Saitama University in Japan who are incredibly jet lagged but yet are with us this afternoon. And especially I want to thank QLoop, our student-run organization that is producing this video series. So for all of us who are here, they're across the hallway in the Pastega conference room. There are light hors d'oeuvres and desserts, and so I invite all of you to join us and have a continued conversation. So on behalf of Western Oregon University, the College of Education, we thank you for being with us tonight.